A lot of our families come to genetics from different avenues. In the outpatient setting, typically they're referred by their primary care physician or another medical specialist that has a suspicion that maybe that child could have a genetic condition. On the inpatient side of things, we act as a consulting service. So we are asked to come and see children who are admitted to the hospital for various conditions. A lot of those are similar to what we see outpatient. So things like birth defects, changes in development, abnormal newborn screening as some examples. But typically on the inpatient side of things, children are in a more acute state as opposed to the outpatient side of things where they're either stable or stably unstable. Whenever I'm meeting families inpatient, I ask if at all possible for the team that's consulting us to please let the family know that they're getting us involved. Even though genetics is becoming a very integrated specialty throughout medicine, a lot of times we're not everybody's favorite specialty to see. So giving them a heads up is really helpful. When I do introduce myself, I explain, of course I introduce myself by name. I explain to them that I'm a genetic counselor. In short, I explain that that usually means that I'm an educator and a patient advocate. And so my job is to sort of help understand if there's a why behind the particular condition that we're seeing. And if there is there something that we could do to take better care of that child? That's always our goal in genetics. We don't want to label anybody. We don't want to make people different. We just want to make sure we're providing the most personalized care that we can for that particular patient and their family. I would say that there are very few families that are excited when genetics is asked to come and see them or if they're referred to genetics. And I do think that even though genetics has come so far, especially in the last 10 to 20 years, there's still a great stigma around genetics and genetic conditions. And I think a lot of that is simply because of lack of education and people not understanding sort of genetics at its core. People, are afraid of what this might look like if their child does have a genetic condition. So there's a lot of fear in that. There's a lot of concern, at least where I practice, and this is sort of dependent on region and faith and religion and things, but there are some people who feel like genetics is borderline eugenics, and we're not going to be supportive of individuals with genetic conditions, or we're trying to fix them or make them go away or not exist. And that's not the case at all. I would argue that genetics getting involved in care, we're sort of making a move towards precision medicine, meaning we're tailoring care to someone based on the core of their individuality or their DNA. We want to make sure we're taking the best care of that particular person. And I think that's a really special thing. Certainly, we want to take care of the person and the family that's in front of us. There's no one size fits all